Young people often find themselves on the edge. Social exclusion, unemployment, money worries, pressure to achieve can make the transition from adolescence to adulthood a difficult time for many young people. In the last 25 years, depression and anxiety rates amongst young people have risen by 70%. Yet at a time when there are less resources and more pressure on services, a large number of young people suffering from mental health problems are finding themselves once again on the edge, struggling to get the support they so desperately need.
I attempted suicide at 13 and then again at 15. The first time I ended up in hospital and the second in a police cell. I was very distressed and felt like my world was ending. I was told I would go nowhere in life. I was self-harming in the cell. A doctor was called and asked to see my arms. I showed him the front so he wouldn't notice and they let me go. The next day, I took an overdose.
When I was 16, my mental health got really bad. My school called an ambulance. I refused to go, so they got the police. They handcuffed me and dragged me in the back of the van. I was sectioned and ended up in an adult psychiatric hospital for 6 months. It was a massive shock.
When I was 15, I took an overdose. It was the worst time of my life. I was taken to hospital in an ambulance and was very disoriented. I remember feeling like the paramedics were looking at me, thinking other people needed their help more. It often feels like you are a burden when it's around mental health.
Lots of workers in mental health are really good and really do care about helping you. I actually feel very sorry for them because they are really stretched and don't have enough resources to do the job how they need and want to.
My first incident happened when I was 14. I had a frame which had my name on it in my bedroom and I punched it, grabbed a bit of the glass. As my mum walked in, I had got it in my arm, so straight away the ambulance was called. I was later diagnosed with personality disorder and bipolar.
Being hospitalised was terrifying. I was 16 and was surrounded by adults with severe mental illness and drug addictions. They helped me, but I was exposed to an adult world I wasn't ready for, and for a bit, it really warped my perception of life. A lot of people in there was very institutionalised, and medication was given out very easily. Before hospital, I had never taken drugs, but I ended up addicted to Valium.
I think the worst thing about having mental health problems is that the first thing you lose is your voice. When I was in hospital, the crisis team had to speak to my parents because I was under 16. I wanted them to talk to me, not about me, because I know myself better than anyone else does. Suddenly, everyone is making decisions about you, and it feels very disempowering.
After I'd been in hospital, I was referred to CAMS. I got given this amazing worker and for the first time built up a proper relationship with someone and they smashed it. But then a couple of years later I ended up back in the same place and things weren't the same. It wasn't the same relationship and took me a lot longer to build a relationship back up.
Relationships are really important. The best experiences I've had is when people have used a bit of humour. Once, a neighbour called 999 and 2 policemen came out. They were really funny and made me feel completely at ease and really calmed me down. Another time, the paramedics put on a Pink Floyd for me and made the journey seem like an adventure rather than something scary.
I like it when they just sit with you and talk to you like a human. It's a different tone of voice. Others are just so clinical and it's like they're reading off a script. I just want them to talk to me, have a conversation without a piece of paper.
I think training is really important in a crisis. You need someone who can be empathetic and understand what you are going through. More doctors, nurses and the police need to be trained around mental health and young people's experiences. It's more complex than physical health because you can't see it and can't just put a plaster on it.
There needs to be more crisis support that isn't phone based. You need someone who is physically there, someone to show you that you do matter and to be able to calm you down. That doesn't always have to be in hospital. Really, in a crisis you want to be in an environment that makes you feel comfortable, so there should be an option of having crisis support from home, especially at night.
Getting help took ages. I was sent from place to place. I'd get an assessment just to get put on another waiting list, and each time they'd get me to fill out the same questionnaire, how do you feel on a scale of 1 to 10. It made me feel like I was not a person, but someone to be risk assessed. I don't know the person who hands me that form, and they don't take the time to get to know me.
Sometimes a crisis is over by the time the crisis team actually get there. That's the reality of crisis. You can be in total crisis but come through it. I wonder how many people would still be here and not have successfully attempted suicide if they just had someone with them to be there and calm them down.
Out-of-hours support is essential. The very nature of mental health and crisis is that it often occurs at night when you are more isolated. I'd love to see the development of a mental health walk-in clinic or a mental health emergency line, like you have 101 for the police. Or you could have mental health first responders. There is still so much stigma around mental health that would feel less judgmental, and you might be given the time and support you need.
Living with a mental health problem can be so isolating. I found that peer support mental health groups really help me because I've come into contact with people my age who are going through similar things and really do understand me. Now, if I am hitting crisis point, I have someone to turn to.
There should be more places to go and the option of police-free intervention. When you have mental illness, you can be very paranoid, and so if the police arrive at your door, it can make things worse. I don't think many police go into the job to deal with people with mental health problems. They are just forced to because there are not enough mental health resources. Often you end up relying on charities to help. What we need is specialist mental health intervention. I'd love to see a service for children and then for adolescents, then adults, because the needs of us all are very, very different.
Sometimes I feel like I have a real love-hate relationship with mental health services. I need them, but I need more than they give me, and I feel like sometimes they don't treat me very well. I want to have a good relationship with the system that's meant to support me.
I feel like a big part of the problem is that mental health systems encourages you to get worse before you can get better. Sometimes I think, do I have to kill myself to get help? I probably do. It happens all the time. People are so desperate for help, but often the only way you can get it is if you are in danger, so you either harm yourself or attempt suicide. It just shouldn't be like that. If there was more focus on prevention and early intervention, things might not get to crisis point, which would be a lot better for everyone involved. It's an exciting time for mental health because together we have the power to make things happen and make the changes needed so that young people no longer feel on the edge.